Welcome to today's news briefing, hosted by LA County's COVID-19 Joint Information Center for Ethnic and Community Media. I'm Pilar Marrero, Associate Editor of Ethnic Media Services. On behalf of our ethnic media outlets, my thanks once again to the Joint Information Center's team for coordinating this valuable service to help us track the county's response to the COVID-19 pandemic and the services the county is providing to ensure the well-being of all LA residents. Today, we are delighted to welcome back Dr. Eloisa Gonzalez, Director of Integrative Medicine, the Wellness Center at LAC+USC Historic General Hospital, for another update on the pandemic in LA County. Then we will turn to the topic of food insecurity in LA County, caused by the economic shocks from the pandemic. Food insecurity refers to disruptions in food access and regular eating because of limited money or other resources. As you will hear from our speakers, nearly 1 million households suffered immediately from hunger-related issues at the outset of the pandemic. Altogether, 1 in 3 county residents experienced food insecurity in 2020. And without further ado, we go to our first speaker. Dr. Gonzalez, thank you so much for being with us.
My pleasure. Thank you, Pilar. And thank you to all of the media outlets for joining us for today's briefing. I'll be providing updates on our current status of COVID-19 cases and information on the new sectors eligible for the COVID-19 vaccine. We continue to make progress in reducing the average number of daily new cases of COVID-19, though our numbers remain elevated. The 7-day average number of daily cases peaked on January 8th with more than 15,000 cases, and now has dropped by 90% to 1,600 a day. Since this number is average cases by episode date, meaning the date a person was tested or began having symptoms, it does not necessarily match the number of cases we report each day in our press release, which is daily reported cases that could have happened days or in some cases more than a week before they are reported to us. I want to thank everyone for making this decline in cases possible. This wasn't a miracle, and this significant drop in our case numbers reflects actions and choices taken by millions of residents, workers, and employers. We should continue to see, should we continue to see less cases, we can move forward in our recovery as lower case rates allow for other sector reopenings. The decline in the daily case rate allowed schools the option of reopening for in-class instruction for students in grades TK through 6. When the case rate drops to 7 new cases per 100,000, schools will have the option of allowing in-class instruction for students in grades 7 through 12. There's been a lot in the news recently about variants of interest and variants of concern. Public Health and USC currently are investigating a cluster of 4 cases of COVID-19 at USC. Of the cases being investigated, 2 patients are confirmed to have the UK variant B.1.1.7, and 2 are suspected as variant cases, still awaiting laboratory confirmation. All cases were detected as part of USC's routine testing and surveillance program. These individuals are doing well and they're in isolation. Their close contacts have been identified, notified, and are quarantining. Scientific research suggests that the currently available COVID-19 vaccines are effective against the UK variant. But with vaccine supplies still limited, the local transmission of the potentially more infectious UK variant underscores the need for Los Angeles County residents to continue to use every tool we have to prevent transmission, including not gathering with people you do not live with, and distancing and masking when you are out of your home and around others. There are now 18 confirmed cases of the UK variant in LA County. To date, we have not yet found any cases with the South African variant in LA County. A news story this week mentioned that researchers at UC San Francisco identified a California variant that is widely circulating and believed to be more infectious and virulent. While we have not seen any of their research documents, we can confirm that between 40 and 50% of samples sequenced in our public health lab since December contain the L452R mutation of interest. As we vaccinate our residents who are 65 and older, we have been noting a very similar and frightening pattern of inequity. As you can see on this table, white and Asian residents 65 and older continue to have the highest vaccination rate. As of February 20th, almost 48% of white residents and almost 45% of Asian residents 65 and older have received at least one dose of the vaccine. 38% of American Indian Alaska Native residents and 34% of Latin residents and 29% of Black residents who are age 65 and older have received at least one dose. And while these inequities are stark and unfair, when we look at the relative percent change from the week of February 9th to the week of February 20th, we see that we are making some progress improving vaccination rates in the hardest hit communities. The vaccination rate for Black residents saw the largest increase at almost 45%. For American Indian, Alaska Native residents, the vaccine rate increased 37.1%, and Latinx residents' vaccine rate increased by 31.9%, while the vaccine rate for white residents increased by 25.1%, and for Asian residents increased by 21.9%. Right now, the gaps in these rates represent inequitable access to vaccines. The shortage of supply has made appointments scarce and difficult to obtain, especially for people who may not have the time or technology to register. Improving access to areas of the county that have been hard hit is our priority. And these tend to be in areas where many Black and Latinx residents live. We have opened additional sites in these areas and are working with community groups who are assisting with registering people in these communities for vaccination. We're happy to see these early increases in vaccination rates as they indicate that our strategies may be working. And we thank our partners for their help and support as we continue to ensure easy access to vaccines in those communities that have borne the brunt of this pandemic. Beginning on March 1st, eligibility for vaccinations in LA County opens up for food and agriculture workers, law enforcement and emergency responders, and education and childcare workers who live in LA County. All eligible workers will be able to sign up for appointments starting next week at the dozens and dozens of community vaccine providers, including pharmacies, health clinics, and City of LA vaccination sites listed on vaccinatelacounty.com and vacunatelosangeles.com. Healthcare workers and residents 65 and older remain eligible for vaccines and can continue to find appointments on vaccinatelacounty.com and vacunatelosangeles.com. An estimated 470,000 people work in the food and agriculture sector here in Los Angeles County. For this sector, because it includes such a variety of occupations, one-size-fits-all approach will not be adequate. There are a number of food services and agriculture workers who may not be easily reached. Therefore, it will be necessary to not only partner with employers and employee organizations. But it will also require coordination with trusted sources for these groups like unions, workplace leaders, community leaders, and community-based organizations. We estimate that about 691,000 people will be eligible for a vaccine in the education and childcare sector. Many school districts have partnerships and capacity to create their own pods to vaccinate their workforce. Independent and parochial schools will be partnering either with their school districts or will have reserved appointments at county pods for their workforce. There will also be opportunities for childcare workers to be vaccinated at closed pods and with reserved appointments at the county pods. For the emergency services and first responder sectors, agencies, including the courts and correctional facilities, we will be partnering with fire departments, police departments, the Department of Public Health, the Department of Health Services, and local hospitals to vaccinate their workforce. We estimate that over 145,000 people work in this sector. In closing, I want to acknowledge the remarkable work that is being done by our many partners to vaccinate people who are currently eligible. There are so many people working on this effort, from the vaccinators at the over 400 vaccination sites who every day are providing vaccines to thousands of people, to our many partners who are continually innovating to create ways for people who are living in the hardest hit areas to have access to the vaccine. There is no shortage of heroes here in LA County, and I could not be more grateful for all of this amazing work. Thank you, and back to you, Pilar.
Thank you very much, Dr. Gonzalez. Talking about supply, which is always the key question when we talk about the vaccines, can you talk a little bit about how that supply is determined and when do we expect it to improve?
Well, so it is very different depending on the sector, how many vaccine doses they are allotted. As we know that we're opening up to additional sectors starting on March 1st and potentially even more after that, supply still remains our rate limiting factor, if you will. So the allocations are made often by the state, and then we sort of implement them locally. In the case of schools, allocations are going to be made to each school district to be proportional to the number of staff, but also weighted for COVID-19 impact on the district, on provision of in-person education, and on the percent of students that are receiving free and reduced price lunch, for example. So every sector takes slightly different areas of importance for that sector to determine the doses that are allocated. But until we have a much greater supply of vaccine, which we hope will increase should the Johnson & Johnson vaccine be approved, we're going to continue to see this competition among all of the eligible residents to be able to compete for the few doses that are available.
So we're still talking about not having enough vaccines coming from both the federal government. I don't know, does it all come from the federal government, or California buys their own vaccines as well?
So we in LA County receive doses from a variety of different flows. However, ultimately, they come all from the federal government. Some come directly from the federal government to certain partners that have been identified and have agreements with the federal government to receive vaccine doses directly. Then there are ways that we get the state of California gets an allocation from the federal government, and then California disperses those across the state to the various different public health, to all the different counties. Usually it's the public health entities within those counties. But also the state, like the federal government, has direct sort of contracts, if you will, with specific partners. The state also has that within California. For example, they partner directly through an agreement with Kaiser, because Kaiser has approximately 25% of all the insured population, healthcare insured, are covered in California by Kaiser. So Kaiser has a direct source of doses that are provided by the state, which are separate from the doses that are provided to the county public health department, to us as a public health department. So the federal government has also established at least one federal vaccination site at one of our Cal State universities, and that also comes directly from the federal government. So ultimately, yes, all the doses come from the federal government, but some come directly and some come through the state.
Okay. For those seniors who had cancellations on scheduled second shot, and I know some of them, and they've been complaining on Facebook, any resolution in sight?
Well, first of all, my apologies to everyone who's had a cancellation. We at the LA County Department of Public Health have not done very many of those cancellations. I believe, or at least it's my understanding, that the majority of the cancellations were at sites that were administering the Moderna vaccine. Because of weather problems around the country, there was a delay in shipments of Moderna vaccine. In the county, our county-operated sites primarily use the Pfizer vaccine. So we really didn't need to do much of any cancellations. For those individuals who are coming to a county pod at any point to receive a vaccine, should they become aware that their vaccine appointment has been canceled, they shouldn't worry. They should, all rest assured that their second dose is guaranteed. And if their second dose is the one that was canceled, all they should do is go 1 week later on the same day at the same time with their white card that shows that they were at that site, either 3 or 4 weeks ago for their first shot, and they will receive their second shot, even if they don't officially get a second rescheduled second dose appointment.
Okay, thank you for that explanation, Dr. Gonzalez. And we're going to move on to Gary Gero, who directs the county's Emergency Food Security Branch. Please go ahead.
Thank you so much. And thank you for everyone being here and for your interest in this topic. It is so critical to the health of our community. Let me start by saying that, the county recognized immediately a year ago that this was not just a public health crisis, but it's truly an economic crisis as well. So many people have lost their jobs as a result of the pandemic. And we understand and know that it's economic insecurity that causes people to go hungry, that causes food insecurity. And so at the same time we were launching our efforts to address the virus itself and to protect people's health, we also launched our food security branch in our Emergency Operations Center. And so I and all of our team are part of the county family that have taken on these new assignments and new responsibilities to respond to helping those in need. We have librarians and parks employees and pool lifeguards and all sorts of county employees that are out either at the vaccination sites or that are working in response to the public health crisis, and also working to help deliver food resources to those who need them. And my own story, if just to maybe digress for a second, is as the county's chief sustainability officer, where I work on policies and programs to address public health and equity impacts of environmental pollution in our communities. But during a crisis such as this, we all in the county are jumping in to provide the support and help that is necessary to get us all through this. So when we launched the food security branch last year, we of course set out to respond with specific programs, and I'll talk about those in a second, but we also wanted to truly understand the nature and scope of food insecurity in Los Angeles County. And we partnered with USC to conduct research among the population. And what we discovered was shocking and astounding. 1 in 3 residents of LA County over the past year have struggled with food getting adequate food resources. And there are 10 million people in the county, so that means 3 million people in this county over the past year have had times where they haven't had enough to eat or anything to eat, and that's tragic, of course. And we've worked very hard to address that, and I think we've made a dent, but this is a huge problem, of course. And some of that research also pointed out who, in particular, those 3 million people are. And we saw that Black and Latinx populations were much more affected than the general population. In fact, 40% of Latinx individuals were food insecure at some point over the last year. That's remarkable. And the other interesting fact that we discovered was that it's really young people, people ages 18 to 40 with children without a college degree who are the most affected. And that I think makes sense if you think people who are in that category, a lot of them are gig workers or restaurant employees, food service workers, and so significant food insecurity among that population. So of course, the first thing we did was to say we have existing programs in the county that are meant to address food needs, and we have programs like CalFresh, which are essentially the food stamp program. And we have a speaker after me that'll talk more about how the CalFresh program expanded. But there's others, including the Women, Infant, Children Nutrition Program, which provides food support to pregnant women and mothers of young children. And given the statistics I just cited, I think it's critical that the WIC program, as it's known, be enhanced and promoted, and we've done that. And we've also, of course, had to respond with expansion of our senior meals programs and to provide home-delivered meals. And we've provided over 4 million home-delivered meals now to seniors. In fact, in total, the Board of Supervisors has allocated over $135 million in County CARES Act funds to provide food support. And there are a number of ways that money has been spent. One that I want to highlight is a partnership that we launched with the LA Regional Food Bank. And we had discovered early on that a great number of local community food pantries had closed as a result of the pandemic. They were either too small to be able to safely socially distance within the pantry, or the volunteers were no longer available to come work at the pantry because people were staying at home, rightfully so. And so we launched drive-through food events. We've now done more than 90 drive-through food events where anybody, no questions asked, no eligibility requirements, can show up and get 50 pounds of food placed into their trunk. We're going all throughout the county to provide these resources, and as a result, we've distributed more than 9 million pounds of food at these events to about 150,000 households. And so that is one of the ways that we've responded. And but we've also, as I mentioned, provided our senior meals program. We've provided $20 million in grants to community-based organizations that themselves have stepped up and responded to need that they see in their communities. We've given out 30,000 grocery store gift cards to the most food insecure. We've provided meals, almost 1 million meals for people experiencing homelessness, and the list goes on. And all of these programs, information about them can be had by calling the county's 211 service or going to our website at lacounty.gov. And I'll just wrap by saying, we are absolutely in the county committed to putting food on the tables of our most vulnerable residents. You can't fight a pandemic on an empty stomach, and we want to offer not just food, but hope. So appreciate the opportunity to be here today.
Mr. Gero, do you have a sense that food insecurity has been growing since the beginning of the pandemic. Has it been stabilized because of your work? But also, is it tied to what we see around the world, where famine and hunger is also increasing due to the pandemic?
We saw actually food insecurity spike in April and May of last year. It was at the highest rates, and that was right as a lot of the stay-at-home orders went into effect and a lot of the businesses were forced to close. Since then, it has come down a fair amount, but not entirely. Prior to the pandemic, there were about 20% of the population regularly suffered from food insecurity. And today, as I said, we're seeing numbers closer to 30%. So it has gone up from pre-pandemic times, but it has been fairly stable. And part of it is, in fact, the response that not just the county, as I mentioned, there are hundreds of community-based organizations that themselves are responding to needs in their communities. The LA Unified School District has stepped up to provide meals. So we're all in this together, providing these resources. And I think they have helped address some of that food insecurity, but also the gradual reopening of the economy. Getting people back to work is the most critical thing. We don't have famines in the United States, fortunately, so that's not a source of food insecurity. The primary driver for food insecurity, as I said at the very beginning, was a lack of financial resources.
Well, thank you all. We're come to the close of this briefing. Thank you for all your expertise and for answering our questions and being there for the LA County residents. Thank you so much.